Greetings, I am Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I am happy to welcome you to the multimedia summary for the journal's July 2017 issue. This month there are 4 articles selected as either our Editor's Choice or Highlights articles. Our Editor's Choice is an original article authored by Dr. Arnoli Absejo and colleagues from the Department of Anesthesiology and Perioperative Medicine and the Department of Neurology at Mayo Clinic in Rochester, Minnesota. The authors discuss the effects that anesthesia and surgery may have on patients with concussion. Concussion reflects mild traumatic brain injury and may be accompanied by other injuries with potential adverse effects on the brain, and these include hypotension, hypoxemia, anemia, and hyperglycemia. The authors reviewed records from patients at Mayo Clinic who had experienced concussion between July 2005 and June 2015, and who had a surgical procedure within the year following concussion. Head trauma resulted from sports injuries, falls, automobile accidents, or assaults. In relation to concussion, interventions were tracked as either related or unrelated, and as elective, emergent, or neither elective nor emergent. The study noted that sports-related injuries occurred most often in younger patients, while falls occurred most often in older patients. A diagnosis of concussion was most likely to be made on the day of injury in automobile-related injuries. In this patient population, 80% of the procedures were performed in patients involved in motor vehicle accidents, whereas only 20%, 25%, and 38% of the procedures were undertaken because of injuries associated with sports, falls, and assaults, respectively. Orthopedic and general surgical procedures accounted for 57% of all procedures necessitating anesthesia. The authors emphasize that acute brain injury may render the brain more susceptible to additional injury imposed by subsequent stressors, such as, among others, diminished cerebral perfusion, hypoxia, and cerebral edema. The authors thus conclude that whenever possible, exposure to anesthesia and/or undertaking surgical procedures should be delayed until concussive symptoms have resolved. This may be challenging as surgery and general anesthesia are most commonly required in the acute phase following an injury, a time when the brain may be most vulnerable to secondary injury. Our first highlight article in the July 2017 issue of the Proceedings is an original article authored by Dr. Lauren Dalvin and colleagues from the Departments of Ophthalmology, Mayo Clinic School of Medicine, Molecular Medicine, and the Rochester Epidemiology Project at Mayo Clinic in Rochester, Minnesota, Olmsted Medical Center, also in Rochester, Minnesota, and the Health Sciences Research, Biomedical Statistics, and Informatics section at Mayo Clinic in Jacksonville, Florida. The authors employed the Rochester Epidemiology Project Medical Records Linkage System to identify patients with Parkinson's disease and melanoma in Olmsted County, Minnesota. The cohort with Parkinson's disease included those patients in whom this diagnosis was confirmed by a neurologist. Based on comparisons with age-matched and sex-matched controls, the authors demonstrate that patients with Parkinson's disease have a significantly increased probability of having pre-existing melanoma, and that patients with melanoma have a significantly increased risk of developing Parkinson's disease. Prior studies suggested that such an association may reflect in part treatment with levodopa, a key treatment in Parkinson's disease, as levodopa may increase melanoma cell growth when studied in culture. However, in the current study by Dr. Dalvin et al. In patients with Parkinson's disease, in whom the diagnosis of melanoma was also made, such a diagnosis was reached prior to the diagnosis or treatment for Parkinson's disease. This finding thus does not support the hypothesis that levodopa contributes to the association of these two diseases. Instead, the finding suggests that this linkage of these two diseases may reflect the presence of underlying environmental, genetic, immunologic, or other factors predisposing to both conditions. The authors recommend that consideration may be given to counseling patients with melanoma as regards the attendant risks for Parkinson's disease, and that melanoma surveillance should be implemented in patients with Parkinson's disease. The second highlight article in this month's issue is a review article authored by Dr. Joseph Feuerstein and Dr. Adam Chaifetz from Beth Israel Deaconess Medical Center and Harvard Medical School, Boston, Massachusetts. Based on publications in PubMed through February 1st, 2017, the authors provide a comprehensive review of Crohn's disease, a chronic inflammatory bowel condition that may affect any bowel segment along the entire length of the gastrointestinal tract. The presenting symptoms include diarrhea, abdominal pain, weight loss, nausea, vomiting, and occasionally fevers or chills. In the review, the authors describe the history, epidemiology, risk factors, phenotype, differential diagnosis, and treatment options. Dr. Feuerstein and Chaifetz discuss how the diagnosis of Crohn's disease is made and the roles of clinical symptoms and signs, endoscopic findings, and radiologic findings in reaching such a diagnosis. Treatment is based on symptom severity and the underlying disease phenotype. Biologic drugs such as anti-tumor necrosis factor, anti-integrin, and interleukin 12 and 13 inhibitors are among the most effective therapies for Crohn's disease. The third highlight in this month's issue is another contribution in the continuing Symposium on Neurosciences and is authored by Dr. James Meskia and colleagues from the Department of Neurology at Mayo Clinic in Jacksonville, Florida, and Rochester, Minnesota. In their review, the authors identify and characterize carotid stenosis and its complications. They discuss asymptomatic carotid stenosis and current recommendations against screening for asymptomatic disease in the general population, and they explore the medical and surgical management of carotid stenosis. Medical management includes antiplatelet, antithrombotic, antihypertensive, and lipid-lowering therapies. The authors review the role of cigarette smoking in increasing the risk of stroke, and they summarize interventions for other risk factors. For symptomatic patients, the authors address the benefit of carotid endarterectomy in patients with symptomatic moderate to high-grade stenosis, including in their discussion the effect of provider experience and volumes on outcomes, and the option of stenting as an option for patients at high risk for complications with endarterectomy. The authors conclude that decision-making regarding whether and how to revascularize patients is only part of the management of carotid stenosis, as a fundamental aspect of the latter involves reducing the adverse effects of medical risk factors, including hypertension, hyperlipidemia, and smoking cessation. You can access these highlights and editor's choice articles free of charge during the entire month of July. Please visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, where you will find other free content such as our Path to Patient Image Quiz, Art at Mayo Clinic, stamp vignette on medical science, and interesting medical images. Please also access the social media buttons at the top of the home page to follow us on Facebook, Twitter, and YouTube. Our website lists many news stories that are based on articles published in Mayo Clinic Proceedings. You can also check out our YouTube channel, where you'll find videos of full author interviews and our 60-second video article summaries. Please listen to our Mayo Clinic Proceedings fireside chat recording, which is available through iTunes as well as from our website homepage. And as always, we greatly thank you for your interest in and your support of Mayo Clinic Proceedings.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.